Hello, welcome to our 6th episode of Clits and Coffee.
This is a podcast where we meet once a month to talk about all things pelvic health.
And I'm Melanie. I'm a pelvic floor physical therapist.
And I'm Zoe Paul McPherson. I'm also a pelvic floor physical therapist.
So it's been a pretty busy month for us.
Yeah, we did a photo shoot yesterday, which was really fun.
That was really fun. Yeah, that was
good. So props to Anne.
Yes, shout out to Anne, our good friend who's a great photographer. We got to photograph all kinds of things for different patient education stuff, and then also us just having fun and showing off kind of the things that we do in pelvic health.
Yeah, we even did a cold plunge.
The cold plunge, that was really intense.
That was chilly.
Like 20 seconds. Didn't last long.
Fail. And then we did a pelvic floor workshop at CrossFit Hierarchy.
Yeah, that was really great. And then we're learning to knit. It was kind of our avenue, one of our avenues, which is going to kind of lead right into what we're going to talk about today. It's one of the avenues that we're doing for our own stress relieving activity, which we did last week, and it was really fun. I could have done it for 24 hours and not been bored at all.
Yeah, I knit in high school and threw away all my knitting needles, and then Melanie decided she wanted to learn to knit, so I bought some new ones.
It's a big learning curve for me. Well, so today we have a really exciting episode. We're going to be talking about urinary urgency and urge urinary incontinence, and we'll talk about what that is, and we'll kind of go into what that looks like when we meet with different patients, and then what things we can do when someone is suffering from urgency or urge incontinence.
Yeah, so we can start with just kind of like the typical patient who walks in and what they'll say to us. Like they tend to have like a high stress job or maybe some anxiety, and they usually think they have a really weak bladder. Like a lot of times they're saying, my bladder just is so weak and it can't hold urine in anymore, so I have to pee all the time.
Yes. Or like my bladder's small.
Yeah.
My bladder is small. My bladder's gotten smaller over time. And they'll complain of always being preoccupied by knowing where a bathroom is, or I need to scope the place out ahead of time so I know exactly where to go, because when I have to go, when the urge comes on, I have to go right then and there.
Yeah, and they may or may not have a trigger. Like some people will say that they turn the key in the front door and they have to rush to the bathroom, or as soon as they get to the grocery store, the very first thing they have to do is make sure they get to the bathroom. So they're kind of peeing all the time.
Yeah, and I think, and also, with the urgency and the urge incontinence, we wanted to do them both because they do often go hand in hand. Sometimes people can just have the urgency and they don't have the leaking with urgency.
Right.
Sometimes people will have such a strong urge that they're unable to control their bladder and they will have leaking. So both, they're going to have similar presentations, and they're also going to have similar things that we'll talk about to try and help them.
Yeah. So in terms of like what on our side, when they're coming in, so they're saying all of these things, that's what they're coming in complaining about, like maybe not being able to get through a meeting at work, long car ride, travel, etc. But really from our standpoint of what we're also looking for is the frequency of urination. So like normal, quote unquote, which really does depend on how much you are drinking, is 5 to 8 times in a day, meaning you can hold your bladder or you go to the bathroom every 2 to 4 hours.
Right. Yes. And that 5 to 8 times is like within a 24-hour period. So then all day, all night, that should be about the amount that you should be going based on your fluid intake. So when people are suffering from urgency or the urge incontinence, they'll typically report numbers well outside of that, where every time they have an urge, they're going to the bathroom. And they'll always feel like they're not like fully empty sometimes. They'll be like, well, I just keep feeling like I have to go, so there must still be some in there. And I know one of the things that, with the bladder is always going to have some amount of urine in there. It should have some amount of urine in there. The kidneys are constantly filtering through the body, so there's always what's called a residual amount of urine in the bladder. So you shouldn't be trying to push out that last little drop. That's one of that is one of the things that I'll talk to people about. Like, it's expected there to be urine in there. Like, you should be able to void, and then there should be a small amount in there, and that's okay.
Yeah, and they'll often, like, in this complaint say, like, I go to the bathroom and then 20 minutes later I get the urge and I go again and a little bit comes out. So, like, yeah, there was stuff in there, and that's where that education comes in of maybe they're not feeling like they haven't emptied it in that moment, but 20 minutes later they go again. And so it's just kind of reinforcing that cycle.
Yeah.
And then a lot of people who I work with will, you know, they'll say, but I drink a lot of water. And when we get into the weeds of it, maybe they are drinking a lot of water, but a lot of times they're also drinking bladder irritants, like coffee, citrus, soda water, like in high volumes without water in there with it.
Right, yeah. And I think that's like a big thing to know is like, and everybody obviously also responds different. Not every single bladder irritant is going to irritate every single bladder out there. But we commonly see the high coffee intake, the high sparkling water, you know, maybe if they are doing some type of sugary drink or something, they're doing those, but then they're not also diluting it with just plain water. So then the only thing that's sitting in their bladder are these bladder irritants.
Yeah.
And that tissue just like does not like that, and it's going to let you know.
Yeah, and like Mel said, this isn't like, these are common bladder irritants.
Right.
It doesn't mean they're an irritant for you, but if we look at when the urge is worse, is it around the time that you're drinking those irritants as opposed to just water?
Right, and it goes with like the concept of like, we're not gonna modify just to modify. Like, if something doesn't irritate them and they don't have an increase in urgency, they don't have an increase in incontinence, then maybe that's fine for your bladder. But if it is, and we start to see that pattern around that particular irritant, that's something that we're gonna need to make adjustments on.
Yeah. And then like other things they'll come in and talk about is this might be someone who says they have a history of chronic UTIs, which maybe they do, but an important thing when it's a chronic UTI report is that we're getting cultures each time they have a UTI, because pelvic floor muscle tension can alter that urge. And so is that overwhelming urge and leaking because there's a UTI, or is it because there's pelvic floor muscle tension?
Right.
And without getting a culture of the urine, we don't know.
Right. And then, you know, I think that it does happen, you know, more often than it should, where people will self-diagnose with a UTI, maybe they'll let their PC, their primary care provider know, and then they'll be on antibiotics when they don't need to be on antibiotics because everything is negative. And obviously, if there is a UTI because there's a positive culture,
antibiotics.
You need the antibiotics. But otherwise, sometimes, yeah, like pelvic floor overactivity can kind of mimic some of that, like, feeling of a UTI, because we get that strong urge, or maybe we get, you know, it feels like burning, but it's not burning because of an infection, it's burning because of the muscle activity.
Yeah. So, and you can get like at home, like little cultures, so that you don't have
like
to
test strips.
Yeah, like a little test strip. They're not as accurate as obviously like what you get at the doctor, but at least it gives you some information.
Right. Yeah. I am kind of glad that is like out there now, so people can know whether they maybe need to follow up with their primary care provider.
Yeah.
Yeah, and then I think like some other things that we see often is specific triggers for people. You know, there's certain moments or certain instances that people get a strong urge where they have the inability to control that feeling. The common ones are putting the key into the door right when you get home, maybe getting close to your home bathroom where you're used to going, pulling up into your driveway.
Or even like for some people, it starts as the key in the door and then it's pulling up in the driveway, and now it's when they're 5 minutes down the road, right? It's like all of these things that are clustering around getting home into the bathroom. Water running.
Yes.
Those are the big ones I tend to see.
Yeah, definitely. And then like also just in general, the not necessarily triggers, but then, you know, people getting nervous in certain situations, people getting nervous when there's a long line. I know you and I have talked about people getting nervous about when there's a meeting, you know,
a workout.
Yeah, right. Yes. Where there's something where they're not going to be able to have access to a bathroom, that not having access winds up being a stressor that increases that urge signal.
Yeah. And so because of those stressors, people will often start doing a lot of just in case pees, which also, like, I feel like I grew up where my mom told me to do that. She's like, all right, we're going on a long car ride, go pee just in case. Like it's gotten so normalized, but it also like has gotten to an extreme with people who are so nervous about not being able to find a bathroom that they'll go pee before running a 10-minute errand just in case, because they're not sure if they're going to have access to a bathroom there.
Yes. And then that over time is what, decreases that time between voids, and increases that urge signal, which I definitely think that we should dive into with like how our body's appropriate response to urge signals is, and then why responding to every single urge signal can be detrimental and lead to issues. So yeah, like with the bladder itself is a stretchy tissue, right? So it responds to stretch receptors, and that stretch lets the brain know how much urine is in the bladder. So we naturally, under normal mechanisms, have a urge signal around like one third or so, and that's a totally normal urge signal. It doesn't mean anything. It just lets us know that we're starting to fill up with fluid in our bladder as expected. And then we get another one around like 2/3 that is the bladder is 2/3 full. There's an appropriate stretch response, and that next urge signal is kind of the one where it's like, okay, you can start like seeking out a bathroom. It's not urgent. We're totally fine, but it would be time where the bladder would be full enough to go to the bathroom.
Yeah.
And then there is like a max level one that's a super strong urge where you do need to find a bathroom. Your bladder is at its capacity.
Yeah. And it's an appropriate strong urge because you have ignored the more recent like 2/3 full and moved on with your life, and your body was trying to tell you something.
Yeah, and that's completely good. Urge is a good thing. Urge is a good thing when we listen to the appropriate urge signals. But then what can happen with the urgency or the urge incontinence is people will start to listen to maybe that first urge, and they'll start to go to the bathroom, and then their bladder starts to respond to lower thresholds or lower volumes of urine, and then that urge becomes stronger, and then they're listening to that one over and over and over again. So then it's not so much that the bladder is getting smaller or weaker, it's that the capacity has gotten lesser because that volume has gotten lesser because they're going to the bathroom more frequently.
Yeah, and they lose out on these, like, I like to think of them as like a wave. Like you have the first urge wave and it's going to subside and go away and you're going to move on.
Yeah.
And now there is one urge wave and it is the extreme.
Yes.
Like there's not really any warnings, which means that it's going to be stressful because you don't have time to figure it out.
Right. And then that goes into what we were talking about earlier, like where, oftentimes it'll be people who maybe have high stress jobs or have a lot of anxiety, where an urge becomes another stressor in their mind, and everything starts to, the brain, the body, everything starts to become really, really stressed because of that urge signal, and then it's suddenly a rush to get to the bathroom.
Yeah, it's really that like fight or flight of I am running and maybe leaking along the way.
Yeah.
And that leaking will reinforce it too, right? Because now you're nervous that you're going to be out in public and it's going to happen again and you're going to pee yourself in pants in the grocery store, right? Like now there is once you get into that incontinence side, it can become even more stressful because you have failed to make it to the bathroom.
Right. Yes. And I think that can be, that's obviously, it can be really like sad and hard for people, and having the education, when they start to work with us, is having that education that strong urge and reacting in a stressful manner is going to overstimulate the bladder, and then when you do have leaking, that bladder just kind of lets go, and it's because of that inability to manage the stress that comes with the urge.
Yeah, so I think that's a good transition. And like, what's your like go-to? Where do you start with someone who comes in with urgency or urge incontinence?
I think first and foremost, pretty much, everybody with, especially this type of incontinence, they're going to get a bladder diary. That is what I'm going to do day one. Let's get a baseline of where you're at. What does your fluid intake look like? What's your frequency? If you are leaking, how often is that happening? And is there patterns around when that is happening? And with your fluid intake, is there a pattern that we can see with that? And sometimes it's obviously going to be great information for you and I, because we can make adjustments and goals based on that. But I think sometimes also it allows patients to see, oh, like this is happening at the same time, or I didn't realize I was going so much, or I didn't realize that I would have leaking at this time when I was getting home, or when I just finished my morning coffee. So that's the very first thing that I will definitely send home with on the first day.
Yeah, and a lot of times what I'll see is people are actually drinking a lot less water than they think they are. And it's probably because they, part of like thinking that your bladder is weak is that you want to limit fluid intake, when really that concentrates the urine and therefore can make you have to pee more.
Right, yes. And that's a really hard concept for people to understand is, well, I'm lessening my fluid intake, so why am I still leaking, or why am I going so much? And it really is, that concentrated urine, where the only thing that's in the bladder are these irritants. So the bladder wants to also rid them of it as well. So even just adding water, having that diluted effect, that alone can sometimes take away the strong urgency. And until people hear that and try it themselves, they want the concept of more, you want me to take in more fluids?
Yeah.
But I'm leaking. But it's the type of fluids that you're putting in that can really make a difference.
Yeah. And then we'll go into like common urge suppression strategies or urge retraining. And really like there are some steps that are like how you do it, right? But the theme of it is that we're trying to take control of our bladder instead of our bladder taking control of us, and we're trying to change the way that we respond to urge.
Yes.
So the most basic thing that like I learned in PT school, learned it in, pelvic floor education, is the like freeze and squeeze, where you have this overwhelming urge, you freeze, you stop what you're doing. If you can sit down, you sit down and you take a couple deep breaths. And those deep breaths are to get out of fight or flight, right? Like your body's go, go, go. It's going to contract. Can we calm things down? And then doing some pelvic floor muscle contractions and some calf raises, which we can get into why that helps. And then distracting yourself. Mm-hmm. So that's like the recipe that is taught. But of course, the end goal is distracting your mind away from the urge and decreasing that stress response.
Yeah. So I think that you and I, have conversations about the common things that we do learn, which do help in some situations. They don't help for every situation or for every person. But like I think the big ones that we learn in pelvic floor courses is, doing the quick contractions when you're trying to prevent yourself from leaking or decrease that urge signal. And I think that can work for some people. My thought process behind that is when we go to void urine or when we go to pee, our bladder starts to contract and our pelvic floor muscles relax. Mm-hmm. So if we're like overstimulating our bladder and our bladder is already contracting and those muscles are starting to relax, that quick contraction gives a signal to our brain that it's not time to go yet. And I think that situation can be very helpful in people when they're out and about. They're not at home. They're out and about and they need whatever technique. If they're in a long line, if they're at a baseball game and they need to stay in line, but they need to make it to the bathroom, those quick contractions can be really helpful to intercept that signal to say, hey, it's not time yet.
Yeah, and then the calf raises are effectively doing the same thing, because when the pelvic floor muscles contract, that kind of sends a signal to the bladder to relax, but the pelvic floor muscles and the calves share a common nerve, or nerve root, and it seems to have the same reverse signaling to the bladder by doing calf raises. So,
or is it a way to distract?
Who knows?
Who knows? But
doesn't matter.
Right. If it works, it works, And then, I think like some of the distraction stuff, like what kind of strategies do you have for people if you're trying to help them decrease an urge and maybe delay toileting a little bit?
It depends on obviously like what the trigger is. So if it's a long line, it's going to be different than say like walking in the front door. If we're walking in the front door, distraction of like accomplishing a task that needs to get done can be really helpful. For example, like if you're bringing groceries in, you have to put away one thing or one bag and then two bags, and just over time can you build that up? And the goal is not that you go from having to go pee as soon as you walk in the door with this urge to I'm putting away 4 bags of groceries and then peeing. Like that one item, that 30 seconds gained, and then walking calmly to the bathroom, that's the first step.
Yes.
We are not trying to go from 0 to 100. Right. Every second that you gain control over your bladder is a win.
Yeah. And I think like having the conversation, you know, telling somebody, okay, well, like we're going to try and delay toileting. We're going to just try and delay it. You can't do too much, you know, like sometimes if I've even said the word 5 minutes to some people, that is not happening. It's like, and that is a stressor. That gives them anxiety to think I have to wait 5 minutes. So starting with 30 seconds, starting with a minute, and then building upon that, them accomplishing that, being able to do that, being able to recognize that they're able to do that, and sometimes they do it, the urge goes away, and then they end up having an extra couple minutes they didn't even know. They're like, wow, that actually like worked. I was able to control the urge, and I found that I actually didn't have to go, so I waited a couple more minutes.
Yeah. And then if they're in line, kind of like the more typical distraction techniques are going to be, you know, like maybe they play a game on their phone, maybe they count backwards. Like everyone hates when I'm like, oh, count backwards by 7 from 100, but like that's hard to do, right? And it's going to distract you. Yes. Maybe not for a super long time. That might not get you all the way through the line, but maybe it gives you 30 seconds before you try something else.
Yeah, definitely. And then, yeah, and I think definitely like the smaller goals work really well, because the last thing that we want to do, especially with this type of therapy and this type of condition, is create more stress with the training. This is a calm the nervous system down, decrease the stress. So we want to set those small goals that seem achievable for the patient that we're working with.
Yeah, and then the other side of it too is taking out just in case pees, where same thing, like I'm not trying to stress them by taking out. It's, is there a scenario that you feel comfortable taking it out to start? So for example, let's say you're picking your kid up from daycare and you know there's a bathroom there, you know where it is, you know how long it's going to take to get there, and it's going to be 15 minutes round trip. And that feels very doable because you have a backup plan.
Right.
Like we're going to start with the ones that you are confident you can do, where you're not peeing before you leave your house. You pick up your kid and you come home, and that's 15 minutes. And then next time, can we do a 16-minute errand? And eventually we take out the just in case pee, where you're going somewhere you've never been and you don't know where a bathroom is. But that's not where I'm going to start.
Right. And that just in case pee goes back to us listening to the bladder at smaller volumes. So then our bladder thinks that oh, well, she always goes when we have this much urine in us, so she must be needing to go right now. So like taking out that just in case pee reprograms the bladder to accept a larger volume without it being super stressful.
Yeah.
Oh, and then like also just like, you know, the concept of walking calmly.
Yeah.
You know, oftentimes we see the pee dance where you have your legs crossed and you're doing this little stutter step to the bathroom, or maybe you're running to the bathroom. That's going to create more pressure. That's going to create more chances of leaking, and that's going to ramp up that urge signal. So actually decreasing, and that's where kind of like the 5 deep breaths come in, and letting yourself walk calmly to the bathroom, not squeezing your inner thighs together, not squeezing your butt cheeks together, not, you know, overactivating your upper trap because you're stressed. Like letting your posture and your body be relaxed as you walk calmly to the bathroom.
Yeah. And one you brought up earlier, which I like have seen work really well, is like the positive self-talk on the way to the bathroom or in line, where you're saying like, you are not full, you got this, I am in charge of my bladder is not in charge of me. And people are often really surprised by like how helpful it is.
Right? I mean, we all need a little positive self-talk anyhow, so like if it's talking to your bladder, that's okay. And it does work. And like, I think it can be so powerful. Like people like become more confident because they're like, wow, like I was able to do that. Like no problem. Like, you know, give me more. What's the next step and stuff. So just like, yeah, being able to like have the confidence in yourself and your body that it can achieve something is really, really great.
Yeah. And other things that like come up with this, I think, are that we didn't like address in what people will often come in with, where it's like not an always, but It tends to be someone who has more pelvic floor tension or overactivity. So, we're going to address other things as well. Let's say they might have painful sex or constipation. So just knowing that those can come into play, because this really is not a weakness thing. This tends to be a tension and a stress thing. So also making sure we're addressing that side of it. But really, like, you treat urge first for almost anything, and that's going to at least help with some of those symptoms.
Yeah, and that's a good point. Like, it's not everybody has, issues with bowel movements or painful intercourse or painful medical exams, but it's something that we do want to clear, make sure we're having that conversation during the subjective, like asking if they do have those situations. And what's really great is oftentimes the treatment it's pretty similar for each category, so all of those things can be addressed at once.
Yeah. And just empowering people to learn, or make decisions based on what comes about from this process. For example, let's say I respond with a lot of urge to having coffee, but I want coffee. Just knowing that that's going to increase my urge, so I can plan accordingly. Maybe I'm not going to have a cup of coffee right before a long car ride because that's going to be hard, or when I'm traveling. But knowing that in the safety and the security of my home, if I want a cup of coffee, I'm going to have an increase in urge.
Right.
And maybe I can dilute it a little bit with water, or something like the alkalizing drops to change the acidity of the coffee and see how I respond. But empowering myself to choose those symptoms and knowing that's going to happen.
Right. Know your patterns, and then, have the freedom to make those decisions. We're not going to tell you, no, you can never do X, Y, and Z and stuff, but we are probably going to say, why don't you see how you feel with it, how you feel without it, and then if you have something to do and you want to be in your best bladder situation, you might not want to do the irritants during those times. And I think until people start talking about this, they might not recognize those patterns. And then once they recognize them, they're like, oh, well, great, problem solved. And then, I think the last thing that we really wanted to dive into was timeline. What kind of timeline do you see with people who are dealing with urgency or urge incontinence? How quickly do they respond? How long does it take?
I think it depends on a number of factors, right? If we sit down and read the evidence, which is actually not bad for urge retraining, it's around 8 to 10 weeks, but that's really an average. You have to look at the person and how long has this been going on for? What state of readiness for change are they in? They're obviously here, they showed up, and so they want to do something, but how nervous are they about making these changes? And are we able to identify triggers, right? The more information we have, the easier I think it is, because it's not me trying to talk someone into it. They can see for themselves what an influence certain things might have. And if they have a stressful job or they're managing depression, anxiety, it's probably going to take a little longer because that influences it.
Yeah, I agree with everything that you just said. It's obviously going to be person to person, and it will take time, but I do think that, those situations, especially the readiness to change, and that goes for anything, that doesn't go just for this, the readiness to change and the readiness to, maybe make some adjustments in not only potentially nutrition, hydration, exercise, stress management, those are hard things to get behind sometimes, so I think that it can be, as quick as somebody just being okay, I see my triggers, I'm just going to stop doing that, and I'm going to do this, and they can respond really quickly. And then there's other things where there's a lot more situations involved that are going to take a little bit longer.
Yeah, and I'm a big proponent of not doing an all or nothing. I think that maybe it takes a little longer for some people, but if you go all in and take everything out, that's probably not gonna, that might help you right now for the next 2 weeks, but our goal is long term. So even just bringing that up, where maybe they can get better in 2 weeks, but are they actually living their life and knowing how to control it if everything is gone and now we don't know what caused it?
Right. Yeah, or I even had someone just go from they got a venti coffee at Starbucks every day, and I was they thought I was going to tell them no coffee, and I was just go for the grande.
Yeah.
And that that was the small goal, the small change, and that alone was like something that they saw, even that saw a difference. So it also motivated them to like see how their body responds to, you know, things like an irritant and quantity of an irritant.
Yeah, I wish that we had better, you know, PT. I feel like everyone always wants to know when they're going to feel all better, when this is all going to go away, and the big answer is always it depends.
Right, and it's going to ebb and flow as well.
Yeah,
as most things in life.
Yeah, I mean,
yeah. All right. Well, we hope everyone enjoyed this. This is a conversation we really enjoy having and diving into it, because it is, you know, there's a lot of things that can influence this. So hopefully this is something that you enjoyed and learned. Please like and subscribe, and we'll see you next month.
Yeah.